Today we will talk about ketamine as a medicine. Ketamine is an anesthetic with dissociative, analgesic, and psychedelic properties. It is used as an anesthetic drug in surgical procedures in pediatric, obstetric, and elderly patients as well as in veterinary settings. Ketamine was first synthesized in 1962 by an American scientist Kelvin Stevens, who was searching for a new anesthetic suitable for use in humans without severe hallucinogenic effects. Ketamine was originally patented in Belgium in 1963 and was approved for use in humans in 1970. Soon after, it was used to treat American soldiers fighting in the Vietnam War. Today, ketamine is most often used as a veterinary anesthetic. However, the drug has valuable applications in human medicine, especially as an anesthetic for children and for individuals undergoing minor surgery. A decade and a half ago, ketamine was discovered to produce therapeutic effects in depression. One of the first studies of its antidepressant properties demonstrated a rapid effect in patients who had not previously responded to pharmacotherapy.
In 2014, Rebecca Bregman was studying emotional behaviors in mice when she accidentally revealed the new effects of ketamine. She used it in trials as an antidepressant drug for treatment-resistant severe depression. The mice that had previously taken the drug appeared to be resistant to the types of depressive abstinence symptoms they typically exhibited after prolonged stress-inducing trials. Bregman ran this experiment again and again and discovered that ketamine seemed to enhance stress resilience to ward-off triggers that often damage the mental health. These data show that ketamine can induce persistent stress resilience and therefore may be useful in protection against stress-induced disorders. Another study of Rebecca Bregman and her colleagues suggests that stress may act a bit like a vaccine, spurring the immune system to build up resilience to it. A new study in mice shows that immune cells can create a memory of stress and possibly defend the body against the ill effects of adversity. In the experiment, researchers injected immune cells from stressed mice into the vein of mice with partially ineffective immune systems. After receiving the cell transplant, the recipient mice became less anxious and more social. The antidepressant effect may be the result of the immune system developing some kind of memory of stress. After the transplantation, the cells develop their protective benefits, similar to the way antibodies build up after vaccination, to combat a future infection. It has been shown that ketamine has a wide range of effects in humans, including sedation, analgesia, and anesthesia. Because of its dissociative mind-altering effect, ketamine is also known in many European countries as a rare drug. Its effects include ketamine whole, nightmare scenes with near-death experience and tunnel vision, severe anxiety, panic attacks, or terrible visions. Many experience the disintegration of their own existence. There is also a risk of developing mental dependence if ketamine is used for non-medical purposes. Sporadic use of dissociative agents is not associated with cognitive impairment, but chronic use causes significant short-term and long-term memory impairment. The most common side effects are pseudo-hallucinations, unpleasant dreams, nausea and vomiting, increased elevation, blurred vision, dizziness, and motor restlessness. The drug can lead to loss of consciousness, which lasts about a quarter of an hour. Hypothermia or dehydration of the eyes can be one of the dangerous consequences. Thus, more than 50 years after the creation of ketamine, interest in it remains. Its value and safety in anesthesiology and the treatment of depression have been demonstrated in thousands of patients. Today, ketamine is returning to clinical practice in economically developed countries, but due to a large number of undesirable consequences, the questions of safety remains unanswered. In our report, we list both the advantages and disadvantages of using ketamine. On the one hand, it has valuable applications in anesthesiology and mental health treatment, but on the other hand, it has serious negative aspects and side effects. Therefore, it's necessary to look for alternative medicines with fewer negative consequences.